So welcome everybody to our first webinar for this summer. This webinar is on 2S-LGBTQ plus older adults experiences with digital exclusion. And I'm your host, Stephanie Johnson. This webinar is funded by the Government of Canada New Horizons for Seniors program, which we received to update our resource portal and to create more unique resources on 2S-LGBTQ plus older adults experiences with the digital divide. Before we start, we'll do a land acknowledgement. So I do acknowledge that we're all coming from different places online, gathering online. So this land acknowledgement is for where I'm located. And so today we recognize that many Indigenous nations have longstanding relationships with the territories where ODLAN's volunteers and partners are located, and we acknowledge our presence on the traditional territory of many Indigenous nations. The area we primarily work, known as Tkaronto, has been cared for by the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nations. This territory is subject to the Dish with One Spoon, One Palm Belt Covenant, an agreement to peacefully share and care for the Great Lakes region. And we also share some resources so you can get more information on how to be involved with Indigenous organizations that provide education to Indigenous communities like Inspire. And you can also find out more about the land you're located on using nativeland.ca. So before we move further into this, me and Hannah will just take a moment to introduce ourselves. So I'm Stephanie Johnson, and I'm a PhD candidate at York University that studies the challenges 2S-LGBTQ plus older folks experience when accessing online service provisions during the pandemic. And I'm also the founder of the Ontario Digital Literacy and Access Network. My pronouns are she, her. And I'm also located in Toronto. Hannah, I'll pass it off to you.
Yeah, hi everyone, and thank you for joining us this afternoon. I'm the co-founder of ODLAN along with Steph. I'm also a PhD candidate at York University in the Department of Gender, Feminist, and Women's Studies. I primarily study mother-daughter relationships. And for this summer, I've been doing some of the resource database work for ODLAN along with Lucy, who's here with us today, which is great. So today is primarily about Steph's research, but we're doing some really great sort of research and growing work this summer to have more publicly available sort of information and resources.
So before we go further, we want to make sure that we clearly define the terms that we're using. So what is digital exclusion? And this is typically referred to as the exclusion from a society dominated by the internet and not having access to the hardware or software needed to benefit from online services. This also includes having the knowledge needed to navigate online spaces. And there's still a lot of people that don't have the knowledge needed to navigate new technologies in a way where they're confident. So digital exclusion can look like a lot of different things for different people. And it's a problem that still hasn't really been addressed even during the pandemic when we fully relied on the internet to access school, work, shopping, and so much more. Near the beginning of the pandemic, EGAL Canada put out this survey that talked about the impacts COVID was having on 2S LGBTQ plus communities in general. And some of the points that I noticed when initially doing my research was that, 10% are more likely to experience social isolation, and this really heightened during the pandemic. There's a greater impact on physical and mental health. And this might also connect to having even further lack of access to mental health services as they shifted to being primarily online. 53% experience employment insecurities, and for older adults, a lot more of them are on ODSP or other government assistance programs. They're also less confident about financial recovery in the future. And now we're seeing, as we're coming out of the pandemic, or so we're told, is that inflation and is really impacting people's ability to afford anything, and people are having to cut back to the bare minimum in order to survive. And internet plans have not decreased in cost at all to make it more accessible for Canadians. So there's a lot of concerns here with 2S-LGBTQ plus people's stability during the pandemic, and how it continues to not be fully supported by social services. These issues really haven't been mitigated by the services that are supposed to help people. So early on, we identified 4 key barriers, and this was connectivity and hardware barriers, environmental barriers, pandemic barriers, and digital literacy barriers. So for connectivity and hardware barriers, as you can see, we have a computer with a little stop hazard sign on it, and or warning sign on it. And this is referring to the fact that, again, hardware and internet plans are very expensive, and it's becoming more and more of well, it always has been a privilege and not a necessity, but the costs, even for a basic smartphone, have drastically increased. And even when you get a smartphone, you still need to pay for additional data plans, and you need access to internet in order to fully use that device. So a lot of community members have experienced connectivity and hardware barriers during the pandemic, and continue to experience that, which we're going to discuss more today. We also have environmental barriers, and you see this house with a mouse eating a wire in front of it. And this is because during the pandemic, we knew that 2S-LGBTQ older adults would have more difficulty accessing 2S-LGBTQ plus programming, especially if they lived in communal spaces like long-term care homes, community living. And they might not feel safe being their whole selves, and they might not be out to other community members that they live with, which might stop them from participating in online programming in like a common area, or if they share a room. But then what we also found was that some people in communal living had pest infestations, and when we did give them tablets, mice ate through the cords. So there is even everyday challenges that we hadn't really fully thought about that were happening when people actually received a device, and we thought that they'd be ready to learn. And they don't have the financial means to necessarily replace those cords if they're damaged. And then we have pandemic barriers, and we have these 3 seniors sitting and looking around. And pandemic barriers refer to not being able to go to the public facilities like libraries, community centers to access their computer labs. A lot of people were relying on these spaces to access internet on their phones, to use their hardware, and all that was gone during the peak pandemic. And then we have digital literacy barriers, and we have the computer here with 2 older adults and 2 younger people. And this is to represent the importance of intergenerational learning and knowledge sharing. A lot of programs that we work with, like Connected Canadians, offer one-on-one mentorship support so that older adults can learn how to use their devices confidently. But we still know that a lot of people don't feel like they have those support systems, or for 2S-LGBTQ plus folks, they don't necessarily have chosen family or children or biological family members that can come and assist them in person with their devices, especially during peak pandemic. So now I'm going to go into sharing what community members are saying, and this comes from my research. So the Queering the Digital Divide Community Needs Assessment was a mixed method study, is quantitative and qualitative study. So I had a survey with multiple choice questions and also short answer questions so people can elaborate on their experiences with the 4 key barriers that I've identified. This focused on 2S-LGBTQ older adults who were 55 plus who resided in Ontario. And the reason I chose 55 plus was because a lot of older adult programming from 2S-LGBTQ organizations generally advertised it as for 55 plus, even though I know traditionally speaking, 65 plus is what is considered senior. In the survey, I again asked them about their experiences with digital barriers during the pandemic, and I was able to gather 50 survey responses in the fall of 2021. So the data presented here today is still forthcoming and still being reviewed, but you're going to get a glimpse into what some of our findings were, or specifically what community members have been saying. So for connectivity barriers, our first quote, originally I paid individually for my internet provider for my desktop computer. We had a computer room in my housing co-op apartment building, which I occasionally used. When the pandemic hit, the computer room closed. Because internet was and is so important due to the pandemic, my building management provided internet for the whole building. Rogers only provided basic cable to the building and the internet was added to the bulk agreement. This was a much more positive response from a community member who, the building, the co-op that they lived in did work with Rogers to add that bulk agreement into their plan to mitigate the issue of closing the computer room. But this isn't the case for everybody that lives in co-op housing. And again, people who lived in long-term care homes or other independent assisted living communities were also locked out of those computer rooms and didn't necessarily have access to the internet, and these bulk plans weren't necessarily offered to them. So it just reiterates the differences in experiences around when something gets lost, how a new solution is provided. And then we had environmental barriers. So for this one, it was, quote, my community in Vaughan, Ontario are still very much conservative, closed-minded, and therefore I'm uncomfortable to come out due to my own safety and well-being, including those of my loved ones. So this community member again expressed that they weren't fully comfortable being their whole selves in the community that they lived in. And this was impacting their ability to participate in online services. This can be public town halls, going to see healthcare providers in Vaughan, accessing social programs in Vaughan that are meant for everybody. So there's still a lot of work here that needs to be done at the community level in order for 2S LGBTQ plus folks to feel included and safe where they live. And then we have digital literacy barriers. So quote, I wish I knew more about the constantly changing world with the internet. I feel inadequate about the daily new things that appear. So with this one, it's about not being able to keep up with new technologies and the language and the changes to software and the updates. A lot of people still struggle with this regardless of their age. And there needs to be more supports in place and more resources that will allow them to, stay in touch with this ever changing world of the internet. And lastly, we have pandemic barriers. So, quote, the pandemic has closed off a number of public spaces where I may have accessed the internet in the past, like restaurants or coffee shops. As a result, I either need to access at home or I need to use my cell phone data plan to access data, which could become expensive depending on how much data is used each month, end quote. So for some people, they might live in a long-term care facility or again, community living, and they're relying on their data plans because internet might not be offered to their rooms. And some people that relied on the restaurants and coffee shops or even the libraries or other spaces during the pandemic they lost a huge piece of where they went to connect online, and where they got sometimes support to connect online. So it just supports the hypothesis that by closing down these public services, it was having a great impact on low-income 2S-LGBTQ plus community members. And now we're going to get into a video from one of our members, Pink Angel.
The challenges were myriad and long-lasting. In fact, they are in place to this day, right now, as we speak. So accessing online services during the pandemic was not only a challenge, often I couldn't connect, period, simply because I didn't have a laptop and I didn't have Wi-Fi. The only thing I had was a phone with mobile data, and that was extremely limited. And then that being a Samsung Galaxy A5 phone, which was about 6 years old at the time, it's now about 7 or 8 years old. It was really glitchy. It dropped calls, and it didn't have enough support from Samsung to update it frequently because of its age. So those were like real barriers that I could not access online services. Libraries were closed. The computer shop about 3 kilometers from me, the nearest one, Web Station on Sinclair and Oakwood, it closed down because of the pandemic. So, and to go to the 519 to book a room and a computer, it took days. And when you got there, things were not working. People didn't know how to set it up. So it was just one thing after another. So we need reliable hardware, hardware that can actually work. And so it's been very challenging to access online services. And not only that, I'm not familiar with online because I'm an analog native. I was born in the early 50s. The word computer was unheard of. Online, internet, those were not part of the vocabulary. So it's difficult to switch to something that advanced overnight. For these data plan providers, Rogers, TELUS, and Bell, and so on, we need high-speed, full internet access and a data plan that's not only affordable to us, but very, very low cost. Say $15 or $20 per month for a senior and slightly more only for a student. We need like seniors rates and student rates because we need that data as much as any other office worker, as any other person who has a family. So, and I'm waiting for the federal government to implement its $20 high-speed internet service to people on low income on GIS and OAS. I haven't heard nothing from them. So I'm waiting on that too. In the meantime, I have no Wi-Fi. So I'm just doing everything on this little tiny phone. So data plans need to be accessed by seniors and students and low-income people at a very, very affordable rate, if not for free. Mm-hmm. Depending on the income, the lower when it is at the poverty level or below, it should be free.
Yeah, as you can see, Pink Angel talks about the significance of or importance of having affordable or even free high-speed internet connections, and how she's been living without that. And so it's really it's detrimental to community members and their well-being to have this access. And so digital exclusion is still very, very apparent. And now next, we're going to go into talking more about what digital inclusion looks like. So what is digital inclusion? And digital inclusion, it works to actively remove digital literacy and access barriers. And it actually empowers people as digital citizens to fully participate in the digital space as it evolves and becomes more dominant in our society. A big thing I noticed in digital divide research was that intersectionality was very absent from the discussion. So we really weren't, the research wasn't examining how social location can impact an individual's ability to fully benefit from the internet. But this research is starting to come out more in the last few years. And then thinking about intergenerational support networks and how we can create ecosystems of care, of technology care, where we don't just have the people refurbishing the devices and keeping them out of landfills, but we have younger generations teaching the older generations and others who need that support how to properly use these devices and fully benefit from them, and how to identify things like misinformation or a scam or malware. So next we're going to hear from Leslie Lee Cam, who's going to tell us her experiences of navigating these challenges and finding the solutions that worked for her.
My name is Leslie Lee Cam. I'm here with my trusty mobility device, Robin. I'm a queer dyke community activist of 46 years. When COVID started, I had an old iPad and I had no idea how to use Zoom. So Steph from ODLAN helped me to learn how to use Zoom and provided me with a new device to help me keep connected, which also helped me to stay on top of my business. Out of the closet. ODLAN and Connected Canadians made a huge difference in my life, because when I got the new iPad, even though I already knew how to use the basics of Zoom, there were certain things that I needed more help and tutoring with. So ODLAN and Connected Canadians provided a tutor for me for 6 weeks on a weekly basis, and it was a really helpful and beneficial program in terms of moving forward and helping me to feel more comfortable and learning all the different aspects and different kinds of things that I could do with this new iPad that I got. So I really appreciate that help. And I know that others who received iPads and got the same tutoring told me that that helped them tremendously also. Moving forward, I would really recommend that organizations use the knowledge and the technology that younger queer folks seem to have quite easily to support older queer folks. I operate from an intergenerational perspective, so moving forward, that would be a great way for organizations to incorporate intergenerational relationships between queer youth and queer seniors, focusing on supporting each other and with devices which will keep us all connected together.
So as Leslie highlighted, there's many strategies organizations can take to be more digitally inclusive and include queer community members in that process. So we need to build inclusion and accessibility into the project planning phase and really think about how we're working alongside the community members to address the challenges that they're experiencing. We also need to recognize the unique needs of marginalized community members, especially BIPOC community members who might live in, a lot of people who live on Indigenous reserves still don't have proper internet access. I spoke with someone who earlier today whose relative is on a reserve and they pay $400 a month for satellite internet. So the costs are quite high to get that service, and it's still not high speed or reliable. And we need to develop programmings and or services that mitigate digital literacy and access barriers. for both 2S-LGBTQ older adults and other community members. And these programs need to include not just hardware lending and technology lending or technology knowledge sharing sessions, but it also needs to include actively advocating for basic universal internet access and affirming, technology hubs where people can go in person and get the information they need to, again, benefit from these digital spaces. So I want to thank everybody who came today and had the opportunity to listen to this webinar. And if you get the chance, our network is continuously growing. So you can learn more about our network partners on the website and the amazing work that they're doing. You can always stay connected with us by following our social medias. And our next event will be in July. So you already are registered and you'll get an invite, but we hope you can make it out. And if you can't, we hope you can watch the recording.